I think that there is a lot of apprehension in the African American or person of color community in regards to taking vaccinations and medical care in general. I think to some extent that really is dependent upon, or let me not say dependent, but it's a result of the history, that people in my community have had with the federal government, with healthcare in general, and that these entities have broken the trust of people that look like me. And with this broken trust comes lack of trust when we're in this pandemic and we're saying this vaccine is something that we need to have. This vaccine is something that will help to save lives. And I mean, there are so many examples of this relationship where this trust has been broken. I think the most widely known one was the Tuskegee experiment, in regards to what happened with syphilis, but there are so many other stories. The stories about Henrietta Lack and cervical cancer, and how her genetics, were used without her knowledge. So I think that the key is building that rapport, building that trust so that all of these historical events don't continue to impact my community. I think that, when having conversations with people that, say they don't want to get the vaccine because of this mistrust, with the medical community, I think the very first thing is to acknowledge that and to say, what, I understand. As a medical community, we have not earned your trust in the past. We have not been deserving, of your just trust and in your ability to just do what we say is the right thing to do. So I think being very transparent right now about this vaccine is very important. So transparently, I've gotten the vaccine. Transparently, I have, recommended it for my mother, for my parents, for the people that I know and love, because I trust the science. I think that the science behind this vaccine is very solid. I don't think that this vaccine is being targeted to a particular community in order to hurt or harm them. And honestly, I believe that the community that includes people that look like me are the people that, kind of disproportionately suffer and disproportionately are having bad outcomes from COVID. So even more reason, that I just want to say, yes, I understand that mistrust. We need to earn that back, but please consider that this could be a life-saving intervention. I think that, we've been talking about earning the trust back, right? Because I think that that's a bond, that has been broken. So definitely when people have a provider or have a physician that they trust, that they understand, not only understands the science, but understands the community, understands the world that we live in, then I think it leads to a more open discussion about, what could be the right decision or what could be the wrong decision, right? So, the African American community, the community of people of color, we suffer disproportionately from COVID. Everyone knows someone that has, passed away from COVID, right? But I think it's being able to discuss that with the patient, being able to put it into kind of real life perspective and to say, hey, we don't have to continue to be a statistic. We have this intervention that could potentially save lives, save the lives of the people that live in your home, save the lives of our elders. Why not, try it? Why not attempt it? But I think it all starts with having good interaction and trust between the physician, the provider, and the patient to be able to build upon that. I did get the vaccine. I got the vaccine the moment that it was rolled out and available for healthcare providers. And, honestly, my reasoning for getting the vaccine has been multifactorial, So I have professional reasons for getting this vaccine, but I also have personal reasons for getting this vaccine. I've lost a family member to COVID, quite transparently. My father passed away with COVID, and I would have loved for him to have the opportunity to be vaccinated. I would have loved to have been vaccinated myself when he was ill, because maybe I would have gotten a chance to see him. So, there was nothing that was gonna stop me from being vaccinated at that point. And so I just hope that people, will take not only my suggestions personally, but also, I've shared a little bit of, some personal things and, understand that at the end of the day, my recommendation, my support for this vaccine is really based not only in science, but personal experience and true and abiding conviction that that's the right thing to do right now. So I would say to anyone that's hesitant and on the fence to, do some research. I think that we have this amazing World Wide Web that has so many places, but go to trusted sites, go to the American Medical Association, go to, major university sites and kind of read about it there, so start with the science that's kind of out here to the public that's really easily digestible, right? Then the secondary thing is talk to your trusted healthcare provider, talk to them about your medical concerns, talk to them about what you may be concerned about regarding the vaccine, talk to them about the research that you have done, and kind of what your concerns or questions would be about that. And they should be able to answer. You should be able to have a reasonable, logical, discussion that's not adversarial, whatsoever. And then, you make a decision.
Definitely the African American community and people of color community, when it comes to healthcare, we have definitely had things occur in the past that have made us concerned, whether other healthcare issues, getting care to our communities, has been a problem. And therefore, there have been concerns, and we understand that. In a situation like this, it's sort of one of those things where you say, we're happy that the disparities have been recognized, and we're happy that the politicians, physicians, healthcare organizations realize that and are now making an effort to at least go out into our communities and make it easier for people in our communities to get the care they deserve. Specifically with COVID, when you look at the numbers are phenomenal in people of color, POCs, getting infected and then becoming sick and dying from it. And there are a number of different reasons for that. Again, healthcare disparities, seeing a doctor, and then getting admitted. As a result, we need for our people in our communities to, one, be educated, but two, be able to get access to the vaccine. What we see, though, is a concern. Is this going to hurt us in some way? And what I tell my patients, generally speaking, is, again, there's a good reason to ask for information and to be educated. But in this situation with COVID, the information is out there. We're very lucky in that we have 3 very good vaccines now from an efficacy standpoint and from a side effect standpoint. And therefore, for me, I've said this is a very good reason for me to get vaccinated. 1, I feel like I'm doing it for my community. But 2, I feel like I'm being selfish because I want to get back to normal. And this is a way that I can do that. And therefore, I was very happy. Initially, I was concerned. But after doing research, I said I want to be at the front of the line. And I was at the front of the line to get my vaccine. I have to admit, I'm very scared of needles. But I have to say, when I got vaccinated, the first vaccination, I did not feel it. I didn't even know that they had stuck me with the needle. Side effects, there were none. The second vaccine was a little bit more sore, and I did have, my arm was a little bit sore for maybe a 24-hour period. But beyond that, no problems. I think for me, what I've noticed is, again, I still wear my mask. I still try to minimize contact, 6 feet separation. When I go to restaurants, I try to eat outdoors now that restaurants are beginning to open again. But I have that sense that things are going to be better, things are going to be okay. So, my message for my community is do the research, but get vaccinated. This is what you can do to help your community, to help your family, to start being able to interact with loved ones, grandparents, and feel comfortable that you're not bringing something home for them. Definitely talking to your physician would be the first place that I would suggest. For other people online, I know that a lot of us now are used to just going online and doing our research. I would always recommend you go to reputable sites, go to sites that are specifically for healthcare, with names that you recognize, whether it's Cleveland Clinic or Mayo Clinic or Mercyhealth. We have a site that you can go to. I'd recommend that you go to those sites because there are a lot of sites that spread disinformation that look reputable. So that would be my recommendation there. And then, even now, I know a lot of churches, a lot of priests and preachers are educating themselves. So going to the church And having that interaction is another way that you can do the research. And again, the different experiments, there are a lot of different experiments, whether it was a syphilis experiment or some of the other things. I think it's very important, you have to know your past to know your future. But the key is that we don't want to be victimized twice. And in this case, the COVID is disproportionately affecting us. One, getting infected, but also getting sick and dying. And therefore, this is an opportunity to help prevent that. And therefore, we don't want to be victimized twice. Now we have the vaccine, but we're not taking it, and therefore we are suffering the consequences. So this is a way to be proactive. I miss, one would never have thought how important it is to go to a restaurant or to visit friends, call them up, go out, socialize without thinking about it. Over the past 8 months, not being able to do that, or having to modify it, whether it's a Zoom call, it really does wear on you. And there is a certain amount of COVID fatigue. But I think the biggest thing is not being able to do something that is proactive, that I'm going to do something proactive. Wearing a mask and social distancing doesn't seem to be proactive. It seems to be more defensive. But getting the vaccine is indeed proactive. And therefore, that's what I felt. And doing this, getting the vaccine, was something that I knew that I could take a step that would benefit me, benefit my family, and benefit my community. And therefore, when I got the opportunity, I was very happy to take it. And I would just say to my community, do the research, but after you've done the research, go out, get the vaccine. It doesn't matter which one. I know we went from not having any to now having 3, and the question is asked, which is better? Right now, if whatever vaccine that you can get, take it. And that's the key that I would say, just get vaccinated.